The availability of ICU beds in COVID units across the state is falling fast. Overall, the state is at 9% capacity, but here in Middle Tennessee, it's just 6%.
News Channel 5's Kyle Horan talked with the doctor at the ICU at Vanderbilt, who says the increase in COVID cases affects all the patients.
That because it really impacts everything else.
No one is allowed in, even to visit.
Many hospitals aren't going to have a bed.
The COVID unit at Vanderbilt is a place where medical professionals are working hard with the sickest people at the hospital.
We need to do things to get the cases down.
We know this because Dr. Todd Rice, the director of Vanderbilt's COVID ICU, is open about what's happening here.
In the last 2 weeks, our volumes have gone up, and they've probably gone up twofold, maybe 2.5-fold. From kind of where we were before that. You know, we've pulled people from some other assignments to kind of help take care of these patients. Nursing's stretched a little bit right now.
That last part is what's dangerous about the current situation.
It's increased numbers and busy.
Nurses and other staff who are moved from other units are leaving behind other patients who also need care.
This capacity issue isn't only for COVID. It means that if you get bad pneumonia from something other than COVID and need an ICU, there aren't very many ICU beds. Or no ICU beds. So even providing care to people that are sick that don't have COVID is going to be affected by this kind of capacity problem.
But the moves have to happen because COVID patients require a lot of care.
They're the sickest patients we have in the hospital. They all have respiratory failure, so they're all having problems breathing. Most of them need a ventilator to help them breathe. They need a lot of support from the ventilator to help them breathe, so they're really sick.
Plus, when someone gets this sick with the virus, it's not a week or two. Dr. Rice says it could last a month, maybe more.
They get really sick, they stay really sick, and they're slow to recover.
Kyle Horan, News Channel 5.
Thanks, Kyle. Dr. Rice urges people to do their part to keep the number of hospitalizations from rising. Wash your hands, wear a mask, and stay 6 feet apart.